Good morning, everyone. I'm Valerie Wolf. I'm the Executive Director of the South Central Region of the Occupational Health Clinics for Ontario Workers. We need to turn off the speaker in this room first since we're echoing. I want to welcome you to the 7th annual MAYDAY Symposium on Workplace Mental Health and Injury Prevention. We did 3 of these events before COVID in person as one-day events. And then we've now done 3, besides this one, we've done 3 virtually as a webinar series, and this is the first year we're doing it as a hybrid. So we're very excited to be together in a room, but as you can see, we're being very COVID cautious. We have CO2 meters on every table, air cleaners everywhere, fresh air, and we're testing and wearing respirators as we're able. So we welcome everyone virtually too. So this is our first time doing a hybrid event. So if we run into any technical problems, don't hesitate to email myself, vwolf@ohcow.on.ca, or write in the chat if you're having problems. But we're hoping that you can see the speakers, see the presentations, and then still ask your questions. People in the room can ask questions, as well as in the chat, you can ask questions. So we're really excited about the agenda today and very excited to be welcoming our guests from the COPSOQ network to take part in today's date. We've been planning it for more than 4 years, I think, since Hannah was here 4 years ago. Then we were already thinking it would only be a couple years, but it's been a long time. So I'm just going to read a land acknowledgement, which is our tradition, to acknowledge the land where we operate and also where we are. And then I'm going to invite our Chief Executive Officer, Michael Roach, to do an official welcome. So Occupational Health Clinics for Ontario Workers recognizes that its work takes place on traditional Indigenous territories across the province. We acknowledge that there are 46 treaties and other agreements that cover the territory now called Ontario. We are thankful to be able to work and live in these territories, and to the First Nations, Métis, and Inuit people who have cared for these territories since time immemorial and who continue to contribute to the strength of Ontario and to all communities across the province. And then we are also meeting in Hamilton, so I'm going to read the Hamilton acknowledgement since we're actually on the land here. The city of Hamilton is situated upon the traditional territories of the Erie, Neutral, Huron-Wendat, Haudenosaunee, and Mississaugas. This land is covered by the Dish with One Spoon Wampum Belt Covenant, which was an agreement between the Haudenosaunee and the Anishinaabe to share and care for the resources around the Great Lakes. We further acknowledge that this land is covered by the Between the Lakes Purchase, 1792, between the Crown and the Mississaugas of the Credit First Nation. Today, the city of Hamilton is home to many Indigenous people from across Turtle Island, which is North America, and we recognize that we must do more to learn about the rich history of this land so that we can better understand our roles as residents, neighbors, partners, and caretakers. Now I want to turn it over to Michael Roche, our CEO, who's going to do some words of welcome.
Thanks, Val. Welcome to Mayday Session 2, and a special warm welcome to our colleagues from the COPSOQ community. We'd like to echo Val's thoughts. Reviewing the lineup today, the agenda looks really exciting. From OHCOW's perspective, we have prioritized workplace mental health as one of the 3 key priorities of our operations, and so have provided significant investment in developing products to assist workers in commissioning of larger surveys to assist with respect to comparative data and point-in-time information on workplace mental health. Today's agenda includes the results from our 3rd ECO survey. The years of the surveys were conducted were 2019 and 2023, and the survey consists of 4,000 workers across Canada, including 1,500 in Ontario. The results allow us to have comparative data at both the national and provincial level, and now that we have done it 3 times, the ability to look at the data longitudinally. The longitudinal aspect allows us to do things such as establish the correct sequence of events, identify changes over time, and provide insight into cause and effect relationships. So as an example, in 2016, always resonated with me a surprising finding with respect to harassment in mining in Ontario, and it was identified as a significant issue. It begged one to consider, why are we seeing this, and is it improving, and why did it occur? So looking at these various issues over a 7-year period with 3 different data sets is what John Oudyk is going to be able to give us a glimpse of today. I'm really looking forward to that story being told and reflecting on what it means and what we can do about it. Workplace mental health is an area of focus for our 5-year system strategy. This is the Ontario Prevention System strategy led by the ministry called Prevention Works. Our Chief Prevention Officer, Dr. Joel Moody, is very keen on having data that can allow us to make informed choices with respect to resources. Having rich data sets and making them available to the system allows for the opportunity to make evidence-based decisions around our prevention activities. The details and patterns of the data help us in identifying risk and hazards, gives us an idea of where to put our resources in order to meet the needs of the workers of the province. So again, the dates of the survey is noted, the years 16, 19, and 23. And you reflect on that time period. It's a period of tremendous change. One reflects back to 2016 and then thinks about workplace today and the changes that have been pretty startling. What does it mean relative to workplace psychosocial trends? For example, if one reflects on the change of technology during that period, it's been pretty remarkable, allowing workers to perform their duties in a variety of different ways. So it'll be interesting to see if we can see any trends with respect to this issue and others that are a result of very different patterns of work over the 7-year period. Additionally, if we note the timing between the survey 2 in 2019 and 3 in 2023, we have to consider how the pandemic has affected how we work. And so it'll be interesting to see those results. A mainstay of our organization is using the data as a comparative data set as part of our COPSOQ survey process. Over the MAYDAY presentation, we'll get opportunities to see some of the results of organizations that have engaged in this process and how they may have made improvements. Additionally, for today, we will see how qualitative comments can potentially be utilized, and this will be done by Dr. Daryl Stephenson later in the agenda. I note that our organization's approach to workplace mental health is to focus on primary prevention activities. We have developed a number of tools such as our website, various guides, surveys, YouTube videos, apps, measuring workplace stress, webinars, online surveys. So all of these are free of charge to assist organizations. And a central place to find them all is on our website, www.OHCOW.on.ca. It's often during workplace mental health presentations, speakers lead with this tremendous cost burden of workplace mental health. And my belief is that these numbers are not generally in dispute, and this may be due to the prevalence and severity of workplace mental health issues, which are readily apparent to most everyone, and it often affects oneself or someone that you know. So there's a very direct relationship to this burden. An example would be the Mental Health Commission notes the total cost for mental health problems to the Canadian economy is, exceeds 50 billion annually. What I do find strange, though, is the comparatively modest amounts of money spent on the workplace mental health prevention in relation to the cost burden. So our hope is that by demonstrating the success of a focus on primary prevention, having good products and services around prevention, by measuring the success with the aid of large surveys and other forms of evaluation and showing instances where companies have been successful in utilizing these resources, then we can make some headway in addressing this tremendous cost burden. We believe that a strong case can be made of the benefit of this approach and that it can be a model that could be adopted by others in an effective prevention strategy to address the challenges of workplace mental health going forward and to get the $50 billion figure going in the right direction. Thanks, and back to you, Val.
Thanks a lot, Michael. A lot to think about, and as we actually now hear from John and Daryl about our 2023 survey results and how they look as they stand, and then in comparison with the previous one. So I think, John, you're going to go first. I guess I could read the title of your session, but I think it'll be on your slide anyway. So John Oudyk is an occupational hygienist in the Hamilton Clinic. He's been a pioneer in workplace mental health and leading OHCOW and leading the system in our efforts, and with the strong partnership of the COPSOQ network since 2012 or before when we started using the survey. So John, Tell us what's happening.
Thank you. Well, I want to recognize some of the international people who are also, are listening in. I saw some people from Argentina. And oh, I'm getting here. Okay. This was the title. I didn't pick it. Val picked it, so just to welcome you to Canada. Anyway, you've come at a beautiful time. It's the beginning of the spring, and this weekend I went for a bike ride and I took a few pictures. The Ontario symbol you'll see in the top right-hand corner has a trillium, and these are some trilliums in the forest, and this is what they look like close up. And we have white ones, but we also have some red ones here and there. And however, when I was driving this weekend to Hamilton, we also have problems with pollution, as you can see in the Steel City here, and we still have heavy industry. For those who are from Ontario, I don't know if you've ever seen green trilliums, but here's an example. And we also have an example of a six-petaled trillium. Trilliums are usually three. So that was my excursion. A few blocks away from here, you'll see a memorial in Main Street. They have walked past it. It has a number of wreaths at the bottom of it. And it's a memorial of the day of mourning, which was April 28th previously. And it's a time when we remember those who lost their lives because of workplace accidents, but also occupational disease. And so we meet in front of the memorial every April 28th of last almost 30 years. Okay. So here we have, there's the right. I hope this is the right one. Okay, yeah, the survey that we use is based on the COPSOQ core with some questions from the intermediate, and these are the COPSOQ ones. But we have also added some extra questions. For the 2023, we added the GAD-2 or anxiety symptom screening survey and the PHQ-2 depressive symptom screening survey. In Stress Assess, which is the vehicle that we use to make the COPSOQ accessible to workplaces, we also have health and safety issues, workplace culture, and we've added to the offensive behaviors, discrimination, and vicarious offensive behaviors, when you're not the victim, but you witnessed the offensive behavior. So the results of our 2023 survey. Oh, okay. I guess I can look at it here. We as Michael said, we had a survey in 2016, but currently our Stress Assess is using 2019, and it's 4,000 employed workers in workplaces in French and English. And we compare the results to that, but we also use an internal comparison, a correlation matrix, and this is somewhat controversial amongst the COPSOQ people, because some people say you should do that, or other people say you shouldn't do that. So, and then we also do a comparison internally amongst departments and groups, and for the Canadian one, it's economic sectors and job groupings. And I'll talk about the comparison with the Canadian average first. And in January to February of this year, we did a repeat survey, the 2023 survey. So we have a question that says, how would you rate the psychological health and safety climate in your workplace? This is a kind of a global question, an overall question, and it's not a COPSOQ question, but about 75% of the people, Canadian workers, were on the positive side of the scale and about 18% on the negative. In the past, we were in 2019, we were at 66% and 20% on the negative side. So things have slightly improved over the pandemic, which I was somewhat surprised at. But I think part of the effect is the effect of working at home. That's doing that. Okay, to what extent would you agree that your workplace has enough resources? And 25% feel that there aren't enough resources, whereas almost 2/3 agree there are. And related to that, you have adequate staffing levels, and you see a higher percentage of people concerned about having inadequate staffing. And that begs the question, well, if you have enough resources, how come they're not being allocated appropriately for the staffing? Then accommodations for things that you have to deal with at home. This is quite positive. Just over 2/3 were satisfied. They agree or strongly agree that they have adequate accommodation, whereas 12% disagreed. And when we broke that down by the COPSOQ question, which asked, do you need to be at home and at work at the same time? Those who need to be at home and at work at the same time are much less likely to agree that the accommodation is adequate, which makes logical sense. We asked a question about job security. The COPSOQ question also talks about insecurity. We asked it the other way around. And we've had a labor shortage in Canada, so job security actually is pretty good. Only 9% were worried about their job security, and 3/4 agreed that it was good. We have a pair of questions that we borrowed from the Norwegian survey that measures workplace climate, and it asks questions when there's an incident. Does the organization look to blame somebody, or does it look for causes? And we find that this question is a good indicator of the culture, whether people are problem solving or if they're covering their behinds. And 16% were on the blame side, and 60%, again, a fairly positive outcome. And then these are the COPSOQ questions, the commitment to the workplace, which is similar to workplace engagement. Here you have a very a very normal distribution, which is always nice to see. The average score being 61. Job insecurity, again, very low. The scales go from 0 to 100. And then work-life imbalance. This improved over from 2019, and we think it's because people are working from home. Job satisfaction, score of 70. We'll compare some of these later on. And overall self-reported health. This was the one factor that declined significantly over the pandemic. And this question, even though it's very simple, in general, would you say your health is poor, fair, good, very good, or excellent? Is a good literature has correlated very well with both mortality and morbidity. And so while it looks like a simple question, drop in the score for this question, I think, is a very important thing that happens. Burnout symptoms, score of 1, and all symptoms combined. We have 10 symptoms now from the COPSOQ, and previously we had 20. We pared that down this time, and the average score is 42, which is fairly similar to prior. These were the new things that we added. The generalized anxiety disorder screener and the depression screener. And we had 28% screening positive for anxiety and 25% for depression. This was higher than Statistics Canada. They did a survey, a very large one, in 2021 in the middle of the pandemic, and they had lower rates than our rates. So we're going to have to dig into that a little deeper and find out why that is. It could be because we're exclusively sampling workers, whereas theirs was in the general population. So then back in 2010, Statistics Canada asked a question about whether you felt you were quite or extremely stressed. And 27% of the population in 2010, here's the question: considering your main job or business in the past 2 months, would you say that you were not at all stressful, not very stressful, quite a bit, and extremely? And if you take the top two, it's 28%, which is almost the same. Statistically, probably is the same. We also had this question in 2019, and then it was 30%. So it has been relatively stable. Offensive behaviors, undesired sexual attention or sexual harassment. We have the 2019 in black, so that was 13%, and it dropped significantly in 2023 to 8%. And again, we assume that part of this is working from home. And then it breaks it down into who the source of the sexual harassment is. Is it colleagues, managers, superiors, subordinates, or clients, customers, and patients? If you add that up, you'll see that's more than 8% because you can pick more than one source. Tony, do you know why that thing is? No, that's anyway, threats of violence, 17% in 2019 and about 14%, largely coming from clients, customers, and patients. Physical violence also lower. Again, the majority coming from clients, customers, and patients. Bullying, the source is different. It's coming more from colleagues and superiors, but it also dropped quite a few points. Again, we think it's because people aren't physically beside each other. Discrimination, a little bit down. And finally, vicarious offensive behaviors also dropped. And we asked people what the offensive behaviors were, and the majority of it is bullying and discrimination. Any of those 6 behaviors, about 42% of respondents. We also looked at the impact. These are the offensive behaviors, and the blue numbers are the people, the total symptom score for people who did not experience those offensive behaviors. So ranging from 38 to 40. However, if you have experienced, let's say, any of these behaviors from colleagues, we took the average symptom score and compared it. And you can see that for, let's say, physical violence from colleagues, the average symptom score was 60, which is quite a bit more than 40. And then if you look at manager and superior, you can see that the same offensive behaviors coming from a different power level in the organization has a bigger impact. And then subordinates, and then customers, and then all sources combined. We asked whether people have a violence and harassment policy. In some provinces in Canada, that's a law that you must have it. But I'm not sure it's that way in all provinces. In Canada, it's provincially regulated, except for workers in certain industries like banking and transportation, which are federal. And so we asked if for those people who had a policy, whether it was effective. And again, we find if we break it down by the people who experience more offensive behaviors, they have a very much lower rating of the effectiveness of the violence and harassment policy. And that, again, is quite logical and expected. Now, if we look at some internal comparisons with the correlation matrix. So these are Spearman correlations. We have all the exposures, the COPSOQ scales down the side, quantitative demands, workplace, and emotional demands are the demands at work. And then across the top, we have different outcomes. We have the symptoms. We have commitment to the workplace or engagement, job satisfaction, work-life balance, and our global psychological rating. And the darker the numbers, the squares, and the closer the number to 1 or -1, the stronger the correlation. Ones with the blanks, there's a very low correlation or no correlation at all. Doing it again, Tony. If we look particularly at all symptoms and job satisfaction, and then we rearrange those in order, then for job satisfaction, the top factor was recognition, and then quality of leadership. Then there's a bunch that are very similar in correlation. And we use this, oops, it's the wrong slide, get that. No, it's colored, but the projector doesn't show it. Certain ones are turning blue, and so anyway, we'll skip that. For engagement, we have the top things, again, rewards and recognition, and predictability, meaning of work. For burnout, emotional demands is the top factor, along with role conflicts, the work pace, lack of justice and respect, and quantitative demands. And for the global question about the psychological health and safety climate, again, recognition is up there very high, along with social capital factors and quality of leadership. And here they are side by side. So you can see that engagement and job satisfaction are fairly similar. Psychological climate is also same, but it's more related to emotional demands, and emotional demands being related to burnout and work pace and quantitative demands. So we also looked at specific groups, and so we had a question about equity-seeking groups that are identified in the Employment Equity Act. These are groups that historically have been discriminated against, and so you can see the percentage of the people that responded that fit into those categories. And here, again, the colors aren't very good, but you can see that for the top, the quantitative demands, Indigenous persons had the lowest scores. And then racialized persons, if you look down the list, also have more. Persons with disability are actually better than average for many of the things. And people who have other than the two main gender identities are also having some problems. And then when we look at the health and well-being and the offensive behaviors, you see it again, a similar pattern. And we also have question number, the original Canadians were the Indigenous, and everyone else of us has come here from different places, and some of these people seem to be discriminated against, and therefore we looked at that also. And here we see that the East Asian column is the one that has some of the most severe scores, but the Latin American ones are actually positive. And a similar pattern here. Then we have the different sectors. We have 18 economic sectors, and so each sector, other than educational and healthcare and public administration, and the sample size is quite small, because there are so many sectors. But if we look at demands at work, the sectors at the top are education and healthcare. And the ones that are least there are IT, manufacturing, and utilities. And then in the middle there, you see accommodation and food services. While the quantitative demands have a low score, the work pace has a very high score, which is an interesting contrast. When it comes to work organization and job content, agriculture, forestry, and fishing had the best scores. Educational services and healthcare are also at the top, except for influence. But at the bottom, we have retail, trade, accommodation, food services, administrative and support and waste management and remediation services. People in call centers fall into that category. I don't know who made up these names, but the long one is just think of call center workers. Then when we looked at interpersonal relationships, again, similar, agriculture at the top. Food and accommodation is also quite high. But at the bottom, we find manufacturing, transportation, warehousing, educational services, and utilities. And then for individual work interface, again, we see the call center workers at the very bottom, and agriculture at the top. Social capital, again, agriculture, and forestry, and fishing, and hunting at the top, and educational services at the bottom. Healthcare is in the middle. And then health and well-being, again, the call center people have the highest symptom scores, which is a negative thing, and agriculture is the lowest scores for that. The IT one is interesting. They have poor self-rated health, but less symptoms. And offensive behaviors, here we see again education and healthcare on top, and then followed by the call centers. and the real finance and insurance, professional, technical, and IT having the least experience with offensive behaviors. Some of the working conditions, like enough resources, job security, staffing levels, accommodation, and things like that. Again, the agriculture and finance on the top, and healthcare and education and arts and entertainment and manufacturing near the bottom. And finally, we have some of the workplace culture items. And again, we see healthcare, public administration, and education at the bottom. But here we see the call center at the top, which is interesting. IT also looks very good from this perspective. And full-time, part-time, 82% were full-time. And then we also asked about non-management workers. Are they unionized? And do you work for another employer? And here we have the full-time. Obviously will, because there's so many, it will look very much like the average, which is yellow. But the part-time, the quantitative demands are low, but the influence and possibilities for development are not good. The contract seems to be pretty good, except for job insecurity, obviously, for contract and seasonal work. And for unionized, it's interesting, you see it generally has worse scores than non-unionized. And you could think of it two ways. You could think that the union's not doing a good job, or you could think that the workplaces that have more problems end up being unionized and therefore need more representation. And working for another employer looks roughly about the same. And here are the health and offensive behaviors. The casual workers, the offensive behaviors are a bit higher than. We asked how many hours do you get paid for a week? The average was about 40 hours. Big range though. And 75% worked the regular shift. And when you look at the number of hours per week, you can see very clearly on the quantitative demands that the more hours, the worse the score. Yet with the less hours, you have less influence and less possibilities for development and less meaning. You see similar down by the relationships, and again, that they're worse for the more hours and better for less hours. And when we look at day shift, which is most of the people, so it's pretty, the on-call actually looks better than most of the other ones. But not having a day shift job, especially the regular nights, seems to be very poor scores. And that's also reflected a similar pattern with health outcomes and offensive behaviors. We asked about extra hours without pay. How many hours? And on average, people work almost 3.5 hours a week without pay. And how often do you work through your break time or lunchtime because of it? And here again, a very clear pattern. People who have more hours, unpaid hours, have worse scores, except for in the area of influence and possibilities for development. A similar pattern for working through breaks. If you always work through breaks, things are pretty bad. However, if you take your breaks, you seem to also be having less influence and possibilities for development. The offensive behaviors and health scores have a similar pattern. One of the problems we heard, especially in fields like healthcare, is people having to do paperwork when they wanted to be doing what their job requires them to do, and that the paperwork is overburdening. And so we asked how often or what percentage of your time do you spend on routine or clerical or record keeping work that's incidental to the important task, 23%. And we also asked about having to be available electronically for your work. And it was spread over evenly, but the responses really show a big difference. If you're required to be available off hours and things like that, your quantitative demands were higher, but your work influence and possibilities for development were better. For those who had no connection to the workplace after hours, quantitative demands were good. However, again, less influence. And the paperwork, again, the pattern is the more paperwork, the more the worse your scores. And they follow the same pattern for health and for offensive behavior. Because of the pandemic, some people are working at home. So we asked the question about the difference. About half our workers who responded to the survey are working at the workplace for the whole week. Others are in different situations. We also wanted to recognize, what about people working on the road who don't have a fixed workplace but drivers and things like that. Here we have the various options. We had an option of whether you work for a temp agency, but we only had 3 people, but I left it on there because it was so bad, except for meaning of work, which was amazing. But I took those out because they're too small. But yeah, here we see that people on leave of absence are probably there for maybe for stress leave, and their scores are bad. But the others are roughly, there's not a lot of difference across the different working from home and working on the road seems to be a fairly positive thing. And the second category, being at home, going to the workplace a couple times a month seems to be the best, but they're roughly the same. Again, I'm going to screen out the people working on contract. Similar pattern. Age and seniority. What we see here is if you're 60, that should be 65 or more. You're probably in the workplace because you want to be there. People who don't want to be there have left, and so you have a pretty good situation. Those under 25 are especially struggling with influence, possibilities for development, and the meaning of work. Also a lack of social support and job insecurity. And but once they get to over 30, it seems to even out. Seniority, a similar pattern, not as stark as the age. And offensive behaviors, the young people, especially sexual harassment and threats of violence are much higher than others. Again, you see the older and the more senior people having less problems. They're also having better overall health, which seems, that 65-year-olds are saying they're in better health condition than the younger and middle-aged people. But again, it might be a survivor effect. If you can work past 65, then you must be in better health. Are you considered to be management? We had about almost 3/4 who were not management. And gender. When I started doing surveys back in the 90s, this question wasn't a big issue, but now this question is such a political question that it becomes, you get to choose more than one, and it becomes very complex. And so I lumped together other cultural gender identities and not listed because there were too few fit in that category. And we also asked about education. And 30% have a bachelor's degree. And here, management and non-management, you see higher demands, but more influence and possibilities and meaning of work. So you see those two switched. Also, their predictability is about how well management communicates, and management seems to think they communicate better than the workers do. And then we have female gender identity seem to have higher demands at work, less influence. But other than that, the rest are roughly the same. Those in the other category are having some problems with interpersonal relationships and leadership, and also work-life conflict more so. When we look at education, you can see a general trend in some of the quantitative demands that the more education, the more quantitative demands you have. But again, you have more influence, possibilities for development and meaning of work, which the lower education do not. But for offensive behaviors, again, what always strikes me here is that the health and offensive behaviors for those who are not in the typical gender categories is, I see this over and over again, very high. They have much more discrimination of vicarious offensive behaviors and harassment than others. Additional comments, these were put into ChatGPT, and Daryl is going to talk about this a bit more, but we were on a call together, and he said, well, send me the data. So I sent him the data, and we kept talking, and in a half an hour, ChatGPT had taken all the comments, over 1,000 comments, and summarized them into these categories: work-life, poor work-life balance, pay and compensation issues, bullying, discrimination, management and leadership, and then issues about the work environment, well-being, language, and COVID problems. And Daryl also did the normal way of doing an assessment, and he's going to talk about that next. And then, so what are the takeaway points that I pulled out from this? It looks like flexibility with respect to working from home seems to work the best. Don't work too many hours. I'm one to take your breaks. You know, you don't know if the cart comes before the horse, the chicken or the egg, which one comes first, but those who take their breaks are doing much better than those who don't. And in our office, we have Murray, who comes along at 10 o'clock and says, come on, guys, we're all going for a walk outside for 15 minutes. And that was before the pandemic. Keep the amount of paperwork under control. That's a no-brainer. Things get worse if you put in extra unpaid hours to get your work done. Again, that's a no-brainer, but many people are dealing with that. There are some advantages to non-full-time work, but also some sacrifices. Good social capital is very important. Trust, justice, and respect. And we need to support those who work involves emotional demands. The emotional demands are very highly correlated with symptoms. And so thank you very much, and I'll turn it over to Daryl. Any questions? Yes, Herman. Yeah. Yeah. Okay. And yes, right. This presentation was just the slicing and dicing. We haven't got to the more sophisticated analysis yet, but that is intended. But thank you for bringing up that point, because that was our intention to do that later on. Okay, Airman was saying that these are these associations that I'm implying in showing these comparisons may disappear if you control for other factors, and we agree very much, and that's in our plan. Yes. Yes, Hanjo.
I'm just gonna leave it as.
Okay.
We're just trying to figure out a microphone to pass around the room that will still connect.
Was somebody else? Yeah, Michelle.
Because I work a lot with migrant agricultural workers, tens of thousands of them who come to the country every year. And if they had the access to complete that survey, I think the responses would be very different in terms of lots of issues around control, sense of security, all sorts of things. So I just burst that bubble a bit.
Yeah, that's a good point, and I should probably also mention that there were only about 43 people in the panel, and the panel is chosen from 120,000 Canadians, and they get regularly sent surveys. So the people that sign up for this agree to participate in the panels are different than the general population and aren't necessarily representative. These were weighted for regional areas and age and gender, I believe, although the gender was pretty well even, but they're not weighted for economic sector. And Peter Smith, who will be COPSOQ meeting on Friday, he's working on trying to adjust it for that. And yes, we expect to see differences once we adjust for economic sector, especially, you know, if it's all the owners of the farms that are answering the question, it's quite a bit different than the laborers, obviously. Thanks for raising that point.
So there are 3 questions. You can maybe turn off the speaker on that computer if you want. It's at the top row. See it? Okay, I'll come and do it. Sorry, this is part of our hybrid wrinkles we're still figuring out. So I'm using my phone as a microphone.
I tried that. That didn't work.
Right here.
There.
Oh,
There we go.
okay. Sorry, we're just creating echoes. So, John, there's a few questions in the chat, and then we do need to keep moving. And one of them was around, I think it was around the safety question. How do you know that the person understands safety? I guess participants' workplaces were assessed by the participants or by the practitioners. I think the answer is the participants, because these were individual surveys, right? How the surveyor knows the participants are well aware of workplace safety and work-related regulation, I think, is kind of the question. It's more questioning the question, I think, than the answers.
I'm not sure which question they're talking about. We had a parallel survey that was done in February and March, where we actually explored that question. We have a scale where we ask people about their rights, about their workplace adherence to health and safety regulations and things like that. So the other survey will address some of that.
Okay, I guess we'll do another presentation of that when we have the data. Thanks. And then there's a question about, do all the relationships presented by these tables have a Spearman score that indicates significant correlation?
Yes, the colored ones are significant, but statistical significance in such a large population size is fairly easy to get, and so just because it's significant doesn't mean it's meaningful. So that's why we shaded them and focused on the stronger ones.
Someone's just saying that it's a very nice benchmarking study. Is there a mechanism to get access to these results for teaching purposes, example graphic slides, or an eventual report? That is our long-term plan, to put it up on the website in a format that people can use for their own purposes, or to ask us more questions as well if you want the data sorted in or reviewed in a different way. But now I think we should switch to Daryl's presentation. So Daryl is the ergonomist in Hamilton, and he did his PhD on concussions in football players from it was a qualitative analysis. So since he came in the door and we heard the word qualitative, he's been hung with and analyzing reams and reams of comments from our current surveys, as well as historically, even going back to some of the others for comparison purposes. So he's going to share what he's been able to discern in the few weeks that we've had this data, and then we'll talk a little bit about the trends while we have time. Thanks, Daryl.
Thank you. Hopefully you can hear me. If not, let me know, Val.
Yeah.
So I looked at the 2023 and the 2019 comments over the last few weeks. It's been quite a grind trying to get through them all compared to the ChatGPT. I was telling John, I feel like I'm working against the robots and the railroad type thing, but But yeah, it's pretty interesting stuff. And listening to John's presentation, a lot of it aligns with what John's saying and really tells the same kind of story. So part of what I wanted to do, what I'm going to try to do a lot tomorrow, is really try to convince you of the importance of the qualitative comments and why you should be analyzing and ways to analyze them so it's more efficient for you. So some of the importance is to provide more in-depth insights into experiences and the perspectives to potentially gain a deeper understanding of the data. Can help understand complex issues by helping to understand the importance of the context and the contextual factors that the participants can talk about, as well as maybe the process by which some of the events that they're talking about have taken place. It helps to clarify both independent and dependent variables and help with theoretical explanations. And even as John was talking there, I kind of wrote down a few things. So he brought up the paperwork and people talking about that. And there's actually two people who were very strongly in the opinion that paperwork should not be looked at as a useless task. And one was very angry, saying, you know, it's not useless and I don't want to teach it. So there's going to be those varying kind of outliers that we might not see in quantitative, but they show up in the qualitative and might tell a different story of maybe a pocket of individuals. And then with the over 65 that John was referring to, there were a lot of comments about that and people saying, you know, 5 years ago I would have answered a lot of these quite differently and my results would have looked different, but since then I'm kind of leading into retirement and that's relieved a lot of stress for me. I'm no longer as worried about money. My kids are all grown up at this age, so it's not as big of a deal. Or I took part-time work, and I'm only working in a meaningful work, and I'm not so worried about the financial situation. And so, as John likes to say, the comments can help put flesh to the bone to help complement the quantitative results. It can help identify emerging themes that might not be addressed in the survey. It can provide a breadth of coverage, hopefully capturing a wide range of possible responses. It can help explore workplace-specific concerns and suggestions that can lead to more actionable findings. And we really find this, you know, in these bigger surveys with the ECOS, it's a little more general themes, but definitely when you go with workplaces, you can get really specific concerns. You know, this department, the West Wing, the thermal comfort doesn't work, or things like that. And that you can really give back to the workplace and say, look, here's something that you can go fix today if it's an actual issue that you found. And it can help understand the organizational culture, just giving it a bigger picture. So just one quote from the ECOS 2019 survey, and I'll let you just read these quotes. There's a bunch of quotes in my survey, but I won't read them to you. So there are quite a few comments that come up like this, and a lot of people trying to explain why they answered certain things in certain ways and what they thought we might have missed. And maybe they were working 2 jobs and they only wanted to talk about one, or they owned a business and they, you know, some of the answers didn't apply, or whatever the situation was. But there's some people saying, hey, look, this might have been missed in the survey, and I want to get this across. So for the analysis itself, basically, I'm taking the data. So I got the ECOS data from John, and I get that in an Excel format, and then I put it, basically take all the wording out and put it into a Word file, and that gets imported into an organizational program. So I use a program called MaxQDA, which I'll show in the next slide. And basically what I do is go through all the comments, and either a single word or a line, a sentence, or a paragraph, I code and label certain labels. And I try as much as I can to use the COPSOQ scales and the wording that goes with them, so that when we present these results, they go alongside with what John's saying. But at the same time, I try to use the wording of the workplace as much as I can, and try not to assume what they're saying or interpret too much, but really use, you know, their local language of that workplace. From there, we get a lot of categories. So you get, you know, thousands of codes, and then you start grouping these into categories. And again, a lot of the COPSOQ wording is used there. And then you can identify bigger themes in the end. So this is kind of what it looks like on my computer, and this is a bit hard to see, but But basically we take all the codes and we would start, so this top one would be poor working conditions, which would be a bigger theme. And from there it stems out. And if I were to open up all those arrows on the left, they would all come out, and you can start to rearrange them, you know, put them in different groupings and see how many times each one was said. Okay. So for the 2023, the question that was asked at the end was just further comments about your working conditions, stress, health, etc. And there were 1,082 comments, well, 25,000 words, about 23 words per comment. So I used max PDA for the organization of the data. And while John showed you the ChatGPT, which can summarize the comments rather quickly, it kind of has a sweet spot for how many, and I'll talk a little about that tomorrow. But these max PDA and in vivo is one that is a very popular one in academics. They are basically organizational tools, and they do have some auto coding features. So you could say how many times was the word stress mentioned, things like that. But they're definitely not systems that can code for you. So they're more organizational tools to keep things together. So you're not putting Post-it notes all over your wall and doing things the old way, which would have took me months to try to do it that way. So some of the themes that I came up with and trying, usually when we go with workplaces, it's more about the concerns and suggestions about that workplace that I'm dealing with. But with this kind of more global ecos data, I found putting them in buckets of, you know, what were people talking about? Well, a lot of it was the poor working conditions that they experienced and what they perceived to be poor working conditions, and then good working conditions. So we found 577 segments were coded of poor working conditions, 213 of good working conditions, 190 of mental health concerns, 44 of the impact of COVID, and then some occupation specific. And then there was a lot of like none or no further comments, so they won't quite add up to the total. So in this poor working conditions, the big category, I broke it down into, so all of these are how many times each was coded. And I generally don't like to quantify qualitative results. A lot of times, especially in workplaces, when you go and say, you know, here are some of the themes, a lot of times they'll say, well, just give me the top three, or, you know, they don't, you know, they really take a quantitative approach to the qualitative results. But the problem with that is you don't know if somebody says, you know, they have, in this case, we have only 2 people say there's problems with the union causing stress. We don't know if you surveyed everybody and asked them that same question, would they say, yes, there is problems, or no? So it's, you know, you have to be a little bit subjective, talk to the workplace, and try to see if it resonates with them. But we just don't know that for sure. So putting all the weight on one or the other, quantifying it that way is a little difficult, and you might assume something wrong. So definitely problems with the workplace, the employer, leadership, management, and supervision was one that was a lot talked about. Offensive behaviors, and this is after answering about offensive behaviors within the survey itself. So all these were, you know, additionally, they wanted to say this. Financial and employment concerns. So these were about poor job security, poor unfair wages and benefits, especially in relation to recent inflation. A lot of people were worried about that, and not being able to be compensated for overtime, which John talked about. A lot of people were, you know, pretty emotional responses about that. An unreliable amount of working hours, lacking benefits, and advancement possibilities. Okay, and then we have poor organizational culture, environment, and treatment of staff. Heavy workload, which is commonly discussed as having added responsibilities, mandatory overtime, lack of breaks, unrealistic expectations on workload, a high pace of work, working more hours than they wanted to. And it was commonly discussed, like John had said, alongside a lack of staffing, not hiring any new staff when others were let go, a lack of resources, and some of this was due to the impact of COVID. So it's interesting when John has these quantitative links, you know, some of these comments exactly tell that tale and say, you know, since COVID, a lot of people have left and we haven't replaced them. Now we're taking on more duties and it's creating a heavier workload and a poor work-life balance for me. So within the problems with employer leadership and management supervision. So this is just a little method I try to keep track of where we're going. So from the last slide, this would have been this one over here that we're looking at. So within that, we had some of these sub-themes of poor treatment of employees, poor leadership, no accountability for management, and then one that was talking about managers having problems with board members. So I'll wait a minute for each of the quotes. In the past, I've tried to read the quotes during this and stumbling through them and kind of lose the message. So within this poor working conditions, and looking at the bigger dark blue circle here, with poor treatment of employees, just straight up saying, you know, we're treated poorly, they treat us poorly, things like that. Only providing lip service to mental health programs, problems, 7 about that. The organization doesn't care about the well-being, and that's kind of related to that one above it. Management seeking profit over people's health. Leadership constantly criticizing employees, that they're unapproachable, blaming staff for bad revenue, realistic expectations, not listening to employees, and micromanaging. So then within the bottom, next biggest chunk of this, the poor leadership. So we had many comments about poor communication, lacking experience or necessary skills, nepotism in leadership positions, that the management was just inefficient, a lack of trust, and that one I remember is about them being liars, leadership rushing impact decisions, and not taking care of problems in the workplace. And I'm sure from the previous one, I probably could have put micromanagement in this category. So then we had offensive behaviors. And I found many comments about different types of discrimination, a lot of comments about bullying, and this was from various sources. I couldn't really create, you know, it's all from management or it's all from coworkers. Some of it's from general public. Harassment in the workplace, physical violence, verbal abuse, negative attitudes from the public, and that they needed stricter policies on offensive behaviors. So now within the poor organizational culture, environment, and treatment of staff, specifically looking at poor work culture, a lot of, you know, the work is toxic, or the work environment is toxic, the culture is toxic. A lot of people not feeling valued within the workplace and within their colleagues and support. Then the unfair treatment of employees causing rifts in the workplace. Okay, and then when looking at poor work environment, we had poor work duties, which I'll get into a little bit more in the next slide. Ergonomic and physical environment concerns, so things like working in a confined workspace or having MSD issues, any type of, you know, bringing their setup back and forth from home, causing them issues, not having a full-time desk at work, having temporary stations. Then outside interferences with work. So this was things like government policies, and even just surrounding. So, you know, people around the building causing problems, and things like that. Some thermal hazard concerns, some safety hazard concerns, which were different from the ergonomic and physical environment because they're directly related to the safety and the health and safety climate, dirty working conditions, and poor IT structure. So within the work duties, we found difficulties, abuse from the public, customers, or clients. So within their job description, they really had to deal with people, and this was a daily problem for them. Constantly evolving work, and not in a good way. And there's a quote that talks about that from teachers recently. Boring work, emotionally taxing work, not meaningful work, no job autonomy. And then when we looked at poor work-life balance, and this was quite a difference from the 2019. Many people talking about preferring to work from home, and there was many lengthy comments about why they should be able to work from home, and really justifying it in various different ways, all the way from personal reasons to environment concerns to efficiency, productivity. Then lacking accommodations was a big problem for people if they weren't accommodated, especially if they had family needs. Some that said they would prefer a 4-day work week. Many complaining about poor shift scheduling, which the quantitative results really broke down a bit better. Working weekends, and that decision makers also need mental health support and breaks. So now looking at some of the good working conditions. So there's about a third of the responses compared to the poor working conditions about this. So good organizational culture, environment and treatment of staff, good employer, leadership, management, and supervision, good work-life balance, financially secure, good workload, and good union. And you can see, so at the start I had in good working conditions, there was 213 comment segments that were commented. And when you add all these up here, it only gets 93. So 120 of them were just very general, vague, you know, things are good, working conditions are good. So they would just be, I just quoted them in the good working conditions, but I try not to assume anything as much as I can. So that's why you'll see the numbers a bit less. The general ones where I didn't want to assume too much, I would just put with good working conditions. So good employer, leadership, management, and supervision. Generally just stated that they like them and that they provided reasons such as being respectful, appreciative, and usually stating that the work-life balance factors that they are provided with and that they are, you know, happy with management for allowing them to have those work-life balance things like working from home. So looking at that first big column there, good organizational culture, environment, and treatment of staff. So people talked about having great colleagues, rewarding or meaningful work, a good workplace environment and culture, that they really enjoy the work, that they have good employee assistance program or a well-run department. And an interesting one that I noticed when I was coding is that a lot of these I would code, okay, this is about stress, but then this is also about good working conditions. And a theme I kind of noticed coming out was that, you know, some people are okay with a little bit of stress in their jobs, and some people perceive that they even like the fact that, you know, their job is a little engaging and somewhat stressful, but, you know, it's rewarding work. They enjoy the work, they like the colleagues, and they feel like it's meaningful work. So that little bit of stress, they perceived as almost a good thing, which I thought was pretty interesting. Sufficient resources, zero tolerance for harassment and discrimination, an inclusive environment, and feeling valued in the environment. With good work-life balance, they thought, you know, being accommodating was great from a workplace, good flexibility, similarly. Getting to work from home, definitely in the 2023 comments, there was more about that. Good breaks, a vacation, and then the fact that they like their 4-day work week. With mental health concerns, you can see it's mostly about stress, and a lot of people just wrote stress. Work is stressful, life is stressful type things. You know, that really was the big topic throughout the mental health concerns. Some about fatigue, definitely related to heavy work, work-life balance, and anxiety, and so on. So within stress itself, there were, you know, 142 comments about stress. 40 of those were talking about stress factors that were outside of work. Some talked about that the individuals should have resilience, that we should be teaching these strategies. Talked about the varying stress depending on the type of year or the job involved, and then stress due to the workplace being wasteful of one person. So factors outside of work, family, health issues, commuting, school, and then the cost of living in Canada. So one thing that's obviously different from the 2019 one was the impact of COVID-19. And a lot of people just talked in general about COVID-19 related stress and what it's doing to their workplace. The fact that they were worried about lacking mitigations for infection control. Government oversight was an interesting topic because they talked about it also within this talk, creating some more stress and some of these regulations coming in, creating stress and creating conflict between people about the topic. So they revealed a wide range of negative impacts. The common theme throughout is that it increased stress and anxiety for workers, stemming from a variety of factors. And one major stressor is the fear of contracting COVID-19 in the workplace due to understaffing and inadequate coverage of staff. Having to show up to work when they're sick because of that understaffing. And this stress is compounded. Sorry, I have to read out. I can't see the notes on here. Compounded by mixed messages as well. So with the news and people arguing about vaccines and mandates and different things, causing an overall impact on the toxicity at work, and people arguing about that. So then there were some occupation-specific comments, not too many. And again, like I said, when you do a targeted, only teachers or anything like that, you get a little more specific. But I tried to tease out some with the occupations here, and I did find some interesting things. Was definitely with teaching. The working conditions reveal a mix of positive and negative experiences. Many individuals express a love for their job, describing it as difficult but rewarding. However, several concerns are raised, including increased demands for data tracking and reporting, implementing new changes without adequate time to plan or collaborate, and the lack of workplace safety in terms of getting an illness. So teachers also express dissatisfaction with their pay, retirement programs, and increased workload. Some feel overwhelmed and stressed due to the pressure to adapt to new teaching methods, paying attention to the students' emotional and mental health needs, and implementing changes that are heavy-handed and impractical. And furthermore, some express frustration with the current lack of support from the government and the general public's lack of appreciation for their work. And several teachers also reported feeling unsupported when dealing with challenging behaviors from students. And some substitute teachers expressed concerns about the lack of medical benefits and increased risk of injury due to working at a variety of school settings. Okay, and these comments also highlight a number of challenges faced by those in the healthcare industry. The one common theme is the stress and burnout that arise from the demands of the job, particularly during the pandemic. Many commenters express frustration with the lack of recognition or support they receive for the work they do, as well as the concerns about poor compensation and working conditions. Several comments also touch on issues related to power dynamics and bullying within the industry. In particular, it was discussed the perception that there was a power discrepancy between staff and surgeons, which can contribute to a toxic work culture. And there was more burnout talked about within healthcare, and definitely relating it to COVID-19 pandemic. So just a quick comparison looking at the two. So I did all the coding for both of them, and then I put them together, and I was like, they were so similar that I thought I had loaded the same file up on my screen, and then I was worried that I analyzed the same set of data, which would have been terrible. But so they're very similar, which is really interesting. And then when I talked to John, he talked about how similar they were as well, with some minor differences. And there was 1,200 comments in the 2019 and 1,082 in the equals 23. So there will be a little bit less in general, but we can see a very consistent pattern with poor working conditions, good working conditions, mental health patterns. But then with the 2023, the impact of COVID-19 was more of the concern, and obviously brought up more. Okay, and then we look at the actual poor working conditions. So very similar again across the board, except for that poor work culture and environment. And part of that poor work culture and environment was discussed more in 2019. Was issues with dealing with the public, clients, customers, and students. And there was also more discussion on safety hazard concerns. In 2019, there was really no discussion of COVID-19 as part of the larger one, so 44. So, with that space, people might talk about something else. Lack of staffing was discussed as being impacted by COVID-19. 16 people discussed working from home in 2023, compared to only 5 in 2019. And more discussed liking it and the benefits of working from home, and again, trying to justify why it should be a part of their work. And there were 2 comments about social isolation. in the 2023 one due to working from home. So again, these little pockets, there might have been more people talking about the benefits of it, but there were some people that said, you know, since then I've been really isolated. That was kind of my social outlet was coming to work. And with the teachers, it was interesting. There was a lot more discussion in the 2019 about violence from students and dealing with that, whereas the 2023 results talk a lot more about the impact of COVID and what they had to do teaching and how that's changed the roles. And I kind of just went over these during the slide, but yeah. And then one more comment was interesting that I found in 2019. Really, the only political comments were kind of about the economy and stuff like that. But there was a lot of more heated left and right comments about politics in the 2023 one, which were challenging to kind of code and to understand. But definitely you can see people were more charged up about politics in 2023 in the survey. So that's it for those results.
Great, thanks, Daryl. I don't actually see any questions in the chat. We're running low on time, but we did allow a 30-minute break. Is there? Yeah, okay. So there's a couple in the room, and Tony's going to use his phone as a microphone. We're getting the hang of this. By this afternoon, we'll have it all straight. So yeah, Hannah, you have a question?
Yes, thank you, Daryl. Two topics that typically come up in the Swedish surveys is about illegitimate tasks, understood as unreasonable or perceived as unfair. And another topic is about different levels of management. So maybe you like your immediate superior, but senior management is the problem.
Yeah.
Do you have some of the same results coming up in your Canadian surveys?
Yeah, I'm surprised I didn't put that down because it's something I was thinking about a lot when I was looking at these. Is, you know, within a one comment, you can see, you know, I like my immediate supervisor, but the new employer or whatever, different levels of management, they definitely like certain ones, and they really describe that. So I found a lot of that, or even just I like my colleagues, but not my supervisors, or the opposite, or at some places there was, you know, they just said, you know, there's a few toxic individuals that are causing most of the problems, but the rest of the place is pretty good. So definitely variation within the management and the levels. And then unrealistic, sorry, the first one, unrealistic work.
Tasks like unfair, things that you think others unfair in society.
Yeah, I definitely seen a lot. Some people talking about in the trades that some of the work was very unsafe, but the people that would get the jobs were the ones that were willing to just turn a blind eye to that, and that was unfair. And the distribution of work was very unfair at work, and based on kind of the mixture and who they liked and didn't like, and you know, with some of the job security issues, they were worried about not doing that job, so they just did it.
Just to clarify, we lump illegitimate tasks in the job context.
Yeah, but I was thinking of the broader concept of the very illegitimate task scale, which is like a lot of questions about things. There's a hot topic in the Scandinavian countries right now.
Yeah, I've got two questions. Nobody can prevent counting in qualitative data. So you did the counting, and counting suggests there is some weighing in these numbers. So the more numbers, the more important is the topic, maybe. Do you know about occupational groups that tend to write a text to fill in something in the questionnaire, and there may be other occupational groups that do not like or cannot write texts so easily? So maybe there is a wrong picture when you count how many times the topic was mentioned.
Yeah, that's a really good point. So you're saying like maybe like academics will write more,
Yeah.
have a different job. Yeah,
The
and
teachers, for example.
yeah, I did notice that for sure. The teachers, they would write lengthier responses, and for sure some sort of bias of who's going to write that amount and what they're going to write. And I do agree with you. That's why I do keep the numbers. There is some importance to that, right? It's if especially in a larger survey like this where there's 1,000+ comments, I do tend to keep the numbers. When it's a smaller workplace, maybe not, because I don't want them to dismiss little things. But yeah, definitely some grading, and yeah, you just got to be careful with it, I guess.
Okay, the second is you have counted the topics and coded the topics, but how about the idea of what the people are writing about? Is it complaints? Is it explanations? Is it solutions? This might be another scheme of coding.
Yeah, and so that's kind of what I was saying at the start, where when I'm doing it more specific to a workplace, I'm looking for concerns and suggestions about the workplace and how, right? And this was, I was perceiving it more as complaints, or saying positive things about their work. So that's why I kind of took it to the poor conditions and good conditions of what they thought. But the way you analyze and your lens going into it, thinking, what am I looking for, drastically changes the end results in qualitative research. And I've seen studies where they take the same one and do it 5 different ways, look at it 5 different ways, and come out with different results. And I teach qualitative research at Western University, and we do a class on that where we'll send out the same sort of data and how people do it different ways and tell the results at the end. And yeah, definitely the way you're framing and what you're looking for. And that's why I think it's great to work with the COPSOQ scales, because you can keep that kind of coding framework in mind. And not get too off base.
Thank you.
That's great. Thanks, Daryl. John, are you able to give us the highlights of the trends? Maybe we'll run like 10 minutes late and still give ourselves a 20-minute break. Does that seem fair? Or?
Yeah.
Great. Thanks.
Find it first.
While John's finding his presentation, I'll remind everyone that we set up today as 3 separate meetings for the efficiency of the live streaming and our recording. So you will have to sign out. We'll end this meeting once we're done the discussion after John's next presentation. And then we'll restart in the other meeting. I put the link in the chat. But you should have it if you registered. It's on Eventbrite. I will put it in the chat one more time before we leave too. Or you can go to our Eventbrite and register if you have to. It's off of our Mayday website. Okay, John, you ready?
Yep.
Great, thanks.
Okay, this will be quick and short because we haven't, as Herman said, you need to look at these things in detail and control for things, and we haven't done that yet. So I'll preempt his comment. But basically, the graphs really show it. Not a lot of change in the demand at work. And work organization, job content, very much similar. You see the scores here and the difference. And green means that it's a positive difference, and red would be. And things that are more than 5, I bolded and put in a larger font. Interpersonal relationships, again, we see that recognition has a meaningful difference from 58 to 65. But other than that, there are minor differences. Interpersonal relationship, again, very similar, although quality of leadership is approaching the 5-point difference. First time my boss has asked me to take off. Okay. However, when we look at the work individual interface, we see some big differences. Job insecurity has gone down, which is a good thing, but work-life imbalance, I checked these numbers. When I saw the difference, I thought there's must be something wrong, but it's, I think, working from home has really improved the work-life balance. And again, I'm going to check these again because I still don't believe the size of that difference. That's huge. Social capital slightly up, and then health and well-being again coming down, and cognitive symptoms slightly down. Behavioral offensive behaviors, they've sexual harassment, threats of violence, and physical violence slightly down, and bullying significantly down 8 percentage points, and vicarious. Again, if you're working from home, bullying gets more difficult, and witnessing other offensive behaviors becomes difficult. So some of that may be an artifact of that. Here's the list, putting it all together. And again, you see the health and well-being grid. And then we followed, we had over 4,000 in each of the years, but we did find that 79 people actually filled out all 3. And I was wondering if there's any validity in watching these 79, because, you know, it's such a small number and so unrepresentative. But I thought I'll try it anyway. And there's a lot more differences that are meaningful differences, and they're all in the better, except for job satisfaction. And then the self-rated health dropped severely, and that was something we noticed. And but for the other things, it's relatively the same improvement in bullying and vicarious offensive behaviors. So what are the trends? I think it depends, and that's why what Herman suggests, a more detailed analysis would be better. Some folks have it better. A few have it worse, but there are more that have it better than have it worse. The drop in self-rated health scores is concerning. The drop in job insecurity is welcome, and it's in sync with what we hear in the news. But we need to do more work with the data, break down the trends by economic sector, job categories, and demographic factors. So this is a very high level, quick view of it. About all that I could do for this session. That was quick. Any questions? Yeah, Herman.
Oh, we need the microphone. Question from the room.
Can you hear me? An analysis of German representative data suggests the same positive trends as you see here, but it seems that the German time window was in the years after the financial crisis up to now, and there has been a positive development of the labor market regarding, for example, employment. More and more people get an employment, and there is a lack of labor of people. So therefore, maybe employers tend to better the working conditions in order to keep the workforce. So I think to look at longer trends, you have to also take the economic cycles into account. Yeah. So of course, it will be interesting to see what happens in the years to come if the economic cycle goes down again.
Yeah.
So it's
Yeah.
not a question, it's a comment.
Yeah, no, thank you. Anybody else?
There's no more comments in the chat. So if there's nothing else in the room, I think we're ready for a break. So we will, as I said before, we will tune out of this meeting, and at 11:30 Eastern time, we will turn on the next meeting and talk to some of our guests, some of them presenting virtually and some here, about the workplace experiences of the survey, and also some a new trying some short or pulse surveys and challenges and successes with that, and then also some other challenges and thoughts from another province of Canada, from Manitoba. So we look forward to seeing everybody back here at 11:30. Thanks for joining us.
There's some cookies over here.